I'm Dr. Sridhar. I'm a consultant neonatologist and currently I work at Alain Mediclinic. On the first day, many parents notice whether the baby is born by normal delivery or by cesarean section. The baby starts vomiting. They gag a lot, they tend to retch, and they may bring out mucus or blood-stained secretions. The blood staining is nothing but the swallowed maternal blood during the delivery process, because the amniotic fluid surrounding the baby gets contaminated with the mother's blood, and obviously this is swallowed by the baby during delivery as well. So there are many reasons why the baby is vomiting, because the stress hormone levels are very high around the labor process or around the delivery time. If a baby is born by cesarean, the medications that are given to the mother to sedate her or to really give her pain relief or to anesthetize have side effects on the baby as well. So it can be related to the stress hormones being high in the system. It can also be because of the medication effect. So either way, it settles down by 24 hours or so. Giving the baby a formula feed because the baby has hypoglycemia or some other factor makes this to be more. If the baby keeps doing this, sometimes we give a stomach wash where we put a tube into the stomach, feeding tube, give 10 ml or saline or so, and remove it. We should be careful to make sure the tube is in the stomach before we give the saline, as there is a risk of aspiration. So again, we only do this if it's essential, if the baby is uncomfortable and this is repeated. If it's occasional vomit, reassure the parents, turn the baby to the side and avoid giving excess feeding. Even if you have to give top-up feeds, give only 10 ml or so, as excess feeds will distend the stomach and cause more vomiting. Again, I mentioned in the beginning about breastfeeding support and not to give formula as far as possible. This is another common concern. A mother comes from home with a bloodstained vomit. Obviously, seeing a bloodstained vomit from her baby is extremely nerve-wracking for a parent. If the baby looks well, however, you don't need to panic. The most common reason for this, especially in a primary mother, is because she's trying to breastfeed, and cracked nipple has happened in the baby during the process of sucking. The blood from the breast is going into the baby's stomach, and obviously the blood is irritant and the baby vomits. So if you see the baby, you need to confirm that the baby is well. There are no concerns, no risk factor for infection, and make sure that the vitamin K injection is given in the newborn period. Again, you might already be aware of the reason vitamin K is given. It's to help stimulate the factors needed for clotting, and all the babies receive the vitamin K in the newborn period. So if you notice this, the mother can still continue to breastfeed, but make sure that the positioning is correct and she's looking after the breast well. So the latch being inadequate or improper is the commonest reason why the crack happens. So she has to take care of the skin. She has to make sure she's not continuously suckling the baby. So she may need to start feeding the baby for 10-15 minutes with appropriate latch and then express milk to save herself. A nipple shield is an option in these situations as well. Again, discuss with the lactation consultant about this.